Assalamualaikum and salam sejahtera everyone. My name is Nuna Dia Natasha. My field supervisor is Miss Syazwani Nabila binti Sanusi. My academic supervisor is Dr. Abi Maliki bin Muhammad Jalil, and the place of clinical training was done at Klinik Kesihatan Bandar Jengka, Pahang. And today I will present about my case study presentation entitled Undernutrition in Orang Asli Child Severely Underweight. So this is the presentation outline. It includes the introduction, medical diagnosis, diagnosis relation, medication or drugs, nutritional assessment or intervention, discussion, conclusion, and also references. As for the introduction, this patient's personal detail, his name is John Doe because he was not registered at the Jabatan Pendaftaran Negara, and then his age was 6 months old, male, and the race is Orang Asli, and then his address is at the Kampung Orang Asli, Kuala Sentul, Maran, Pahang, and then he has 2 siblings, and he was the youngest, and he has one elder brother. And then his living situation is he lives with parents and siblings, and then his education level, his parents educational level was, the parents never been to school and they were illiterate. And then as for the smoking or alcohol consumption, his father is a smoker, and then it was noted that they were not consuming alcohol. And then the physical activity, the parents has moderately active physical activity, and then the family history was not applicable. And then the medical history, the boy has history of infected umbilical cord and viral bronchopneumonia. As for the background of the case, this patient was registered as undernutrition new case under nutritionist. The date of referral was 14 December 2019 by medical officer from Klinik Kesihatan Jengka 2, and then the date of home visit was on 21st January at 3 p.m. and then the place of visit was at patient's home at Kampung Orang Asli, Kuala Sentul. And then the reason of visit was for weight gain diet and nutrition counselling or education for the mother. And then the date of follow-up was on 3rd March 2020, and the methods of follow-up was via home or follow-up at Klinik Desa Kuala Sentul. So this is the case chronology. This patient was a term baby at 38 weeks and weight at birth was 2.6 kg, and then he was delivered by spontaneous vaginal delivery or SVD. And then patient was admitted to hospital on 28 August 2019 due to infected umbilical cord. And then the second time he was admitted was on 9 January 2020 due to viral bronchopneumonia. And then the patient was referred to nutritionist for underweight problem on 14 December 2019. On 21st January 2020, he was registered as new case at Klinik Desa Kuala Sentul for monthly checkup, and then referred to nutritionist for weight gain diet. And then his current weight to age was 6 kg, and then the 24-hour diet recall was done by nutritionist, and the diet recall shows that he only be given Similac 3 scoop 150 ml 4 times per day. And then on 21st January 2020, the first visit was done by nutritionist and us, and then home visit at Kampung Orang Asli, Kuala Sentul was done with the nutritionist. And then the child was crying and did not wear diapers. And then 24-hour diet recall shows that he only being fed 3 scoops of milk in 90 ml bottle 4 times per day. And then as for the second home visit at Kampung Orang Asli, Kampung Orang Asli, Kuala Sentul, the child was crying and did not wear diapers. And then weight cannot be measured using spring balance as child did not cooperate. And then the 24-hour diet recall, the mother fed 3 scoops of milk in 90 ml bottle 3 times per day, which were fewer than the first visit. And then the mother complains of they did not eaten anything since the morning, and then did not start complimentary food to child as they have no food at home. And then on the third visit at 9 March 2020, the home visit was done again, and then the mother and the child was sitting outside their house, and then measuring scale and length scale was brought by us, and the anthropometric measurement were taken, and then the 24-hour diet recall has shown that the mother fed him 3 scoops of milk in 90 ml bottle 3 times per day, and she has added 1 cup of rice porridge 3 times per day for the boy. As for the medical diagnosis, this patient was diagnosed as undernutrition, and the percent of children aged under 5 years whose weight for age is below -2 standard deviation of the WHO child growth standard median. And then the undernutrition denotes insufficient intake of energy and nutrients to meet an individual's need to maintain good health. And then undernutrition encompass both protein, energy, and nutrition as well as micronutrient deficiencies. As we can see here in the figure, the malnutrition is caused by many factors such as the inadequate food intake, poor environmental sanitation, poor household food security, illiteracy, lack of awareness, non-utilization of health services, and the malnutrition can cause infection, and also infection can also cause malnutrition also. Okay, so this is the medication or drug history by the patient. He has many drug history because he was admitted few times before at Hospital Jengke. And then the current medication, he has no drugs given because he is referred as undernutrition, and we are only uh, encouraging the mother to give him food to undertake this problem. Okay, now we move on to the nutritional assessment or intervention. This is the assessment. We use SOAP, which are the subjective, objective assessment and plan on the first visit during 21st January 2020. As for the subjective assessment, we find that the weight for age is 6 kg, which are normal. The length for age was 62 cm and normal. BMI was 15.6 kg per meter squared, which are also normal. He has the history of admitted to Hoshias, which are the hospital Temerloh on January due to bronchopneumonia, and currently healthy. The objective assessment was to ensure the child has enough milk intake to promote optimal growth, and also to ensure the child achieve energy intake of 613 kilocalorie per day. These numbers was referred from the KKM book. And then the assessment, the 24-hour diet recall shows that his mother gave him 3 scoops of milk in 150 ml bottle 4 times per day, and then 3 scoops of milk equals to 26.1 gram of energy, and then 26.1 gram and equal to 135 kilocalorie times 4, because carbohydrate give 4 kilocalorie. And then the energy was 540 kilocalorie, which did not meet recommended kilocalorie intake per day, which are 613 kilocalorie. And then the plan was to ensure the child to be given back at least 5 times per day, which will give 675 kilocalorie, and then to ensure the mother to clean the bottle thoroughly every time after feeding, and then to ensure the house cleanliness, and then to prepare for complementary feeding when the child is 6 months old on 21st February 2020, and then to register into food basket case on February 2020. And then the monitoring and evaluation was till TCA on 3rd March 2020 to measure weight and height and assess his 24-hour diet recall. Okay, so this is the picture of home visit during the 21st 21st January 2020, and then this is the picture in front of the house. And this is the picture of the milk that the Ministry of Health has supplied to the child. Simulate Pro. Okay, next we move on to the assessment SOAP on the second visit on 3rd March 2020, and then the subjective assessment. We found that the weight for age was not applicable due to unsuitable equipment used at home visit, and child did not cooperate because he was crying. And the same goes to the length and BMI. The child was crying probably due to hunger, and he was not on diapers. However, he was pink, alert, febrile, which not fevering, and no runny nose, and had a good respiration. As for the objective assessment, to ensure the child has enough milk intake to promote optimal growth, and to ensure the child achieve energy intake of 613 kilocalorie per day. As for the assessment, on the 24-hour diet recall, as told by the mother, he was given 3 scoops of milk in 150 ml bottle 3 times per day, which give 405 kilocalorie, which did not meet the recommended intake of 613 kilocalorie per day. So the plan is to ensure child to be given milk at least 5 times per day, which give off 675 kilocalorie, to ensure the mother clean the bottle thoroughly every time after feeding, and to ensure the house cleanliness, and to start complementary feeding as the child is already over 6 months old by starting with plain porridge 3 times per day, mixing protein and vegetables into porridge 5 times per day, and adding a teaspoon of oil into porridge. And then monitoring and evaluation, the TCA will be done on 9 March 2020 to measure weight and height and assess 24-hour diet recall again. So this is the picture during home visit on 3rd March 2020. We can see that the nurse is measuring the child using spring balance, and the measurement cannot be taken because the child was not cooperating. And then this is the kitchen, which we can see that she is cooking at her living room with some messy things around. And then on the right side is the mother with her 2 kids, and the patients are in the red t-shirt. We move on to the assessment SOAP on the 3rd visit, which were done on 9th March 2020. The subjective assessment was the weight for age is 7.2 kg, which are normal. Length for age is 63 cm, normal. And BMI is 18.1 kg per meter squared, which are normal also. On the subjective assessment also, we find that the child was not crying, and he was not on diapers during the visit. He was pink, alert, febrile, no runny nose, and has a good respiration. And then as for the objective assessment, is to ensure the child has eaten complementary food to promote optimal growth, and to ensure the child has achieved energy intake of 640 kilocalorie per day. And then the assessment, the 24-hour diet recall, we were told by the mother that he was given 3 scoops of milk in 90 milliliter bottle 3 times per day, which give off 405 kilocalorie, and then 1 cup of plain rice porridge 3 times per day, which give off 498 kilocalorie, and the total calorie intake per day was 903 kilocalorie per day. And we can conclude that the child has achieved the recommended calorie intake per day. And then the plan is to recommend the mother to continue feeding with plain porridge 3 times per day, and mixing proteins and vegetables into porridge 5 times per day, and also adding a teaspoon of oil into porridge, and to advise mother to give milk after porridge to prevent milk fullness. And then the monitoring evaluation, the TCA on May 2020 to measure weight and height and assess to 24-hour diet recall, and to advise on the feeding for child as he is becoming his age will surpass 8 months old. Okay, this is the picture of home visit on 9 March 2020. So in the first picture is the interview session. I am doing the 24-hour diet recall with the mother, and then on the second picture is the weighing session. We brought the weighing scale and also the length measurement from the clinic to the house to measure the weight and also the length. And the third picture is the feeding bottle. We can see that the bottle was not clean enough, and the mother was taught on how to clean the bottle thoroughly. Okay, so this is the growth chart weight for age, and then we can see that on the 6 month his weight was normal compared to the first to 3 months of life, which were below 3 SD, which were the underweight. Okay, next this is the growth chart for length for age. We can see that the length for age is normal, but so it is between normal and negative 2 SD. And this is a growth chart BMI for age. We can see that the BMI is normal at 6 months old compared to the first 2 to 3 months of life. The BMI was negative 3 SD. And then this is the summary for overall progress of weight, length, and BMI. This is the weight, length, and BMI from age at birth to 6 months, and we can see that from at birth and first 2 months, the weight to age dropped in the first and second months of life, and then the child's growth on life was quite slow as the z-score showed negative readings on first and second month and also on the 6 months. And then we can see that the BMI was normal for all months. Okay, on figure 1 shows the growth chart of the child during first, second, and third visit on the weight, length, and BMI. This is the summary for overall progress of dietary intake. I have done 3 visits, and then we can see that the intake requirement did not meet the recommended intake of 640 kilocalorie per day during the first and second visit, and the calorie intake decreased during second visit due to lack of milk left at house and no food were around. And then the calorie intake improved during third visit as the mother started to give complementary food to the child. Figure 2 showed the calorie intake of the child during the first, second, and third visit. We can see that on the second visit, the child has the least food given and least calorie intake. And then on the third visit, the calorie has become normal according to his age. Next, we move to the discussion part. The patient was diagnosed with severe underweight, negative 2 SD, with a history of infected umbilical cord and viral bronchopneumonia. And then the main concern for this patient is inadequate calorie intake per day. And then the adequate calorie intake was 613 kilocalorie per day is important for the child's growth and prevent infectious disease. And then the energy requirement of 613 kilocalorie per day of 413 kilocalorie per day from milk and 200 kilocalorie per day from food was advised to the mother to be given to the child. However, the execution was quite hard to be done due to some factors. Some of the factors are due to food insecurity, poor feeding practices, and negligence to receive proper health care. This is because the patient was from Orang Asli and the mother did not have jobs, and they depends on hunting and gathering method of food searching. And then there were also many factors that contributes to child malnutrition, and it was majorly influenced by 3 fundamental determinants, which are food security, adequate care for mothers and children, and proper health environment including access to health services. And then to counter the problem, Ministry of Health should work together with Jabatan Kebajikan Orang Asli Kuala in order to help this family to get access to food, thus prevent food insecurity. Besides, Ministry of Health had Also supplied the formula milk for the child once in a month in order to increase calorie intake. Besides, proper hygiene of milk bottle did not executed excellently because the mother was not psychologically healthy or marrying as claimed as by the nurses. The poor home environment and poor child practices by the mother could result in infectious disease to the child. A study indicated that the poor child care practices such as proper hygiene were linked to childhood malnutrition. And to counter this problem, the nurses has taught the mother to wash the bottle properly and thoroughly and after feeding in order to prevent the child from getting infection or diarrhea. As for the conclusion, proper diet and feeding practices as per 613 kilocalorie per day can improve the nutritional status, thus improve the weight and growth of the child. The dietary modification and proper hygiene practices may not only be beneficial to prevent infection, but can also improve overall health, such as reduce risk for undernutrition. So this is the references. Thank you. That's all from me.